Less than 10% of people with Medicare have taken advantage of the free diabetes screening benefit. Why do you think this opportunity isn't utilized more often?
They don't know about it. That's what this campaign is about.
As a matter of fact, I didn't know about it.
He paid for the last one.
No, seriously. That's very simple. They don't know about it.
Okay.
That's what we're trying to do with this campaign, is let people know that it's important, number one, to do it, because 7 out of 10 are evidently pre-diabetic and or diabetic. People are over 65. Yeah, so that's number one. Those statistics are pretty appalling.
How do I qualify for the free screening through Medicare?
The free screening, though, with Medicare, you have to have one of the risk factors for diabetes. You have to be over the age of 65 with either a family history of diabetes, hypertension, high cholesterol, overweight, or what's called gestational diabetes, or being diabetic during pregnancy. If you have one of those risk factors plus you're over age 65, then you qualify for the screening benefit.
Freebie.
Yeah.
If I don't have Medicare, where can I go to get screened?
Well, age 65 and above, you qualify for it. But if you're under 65, typically you usually have your own doctor that you can see. If you don't have a doctor, many of the hospitals and many of the communities will have a screening day in which you can come in and do various things like check your blood pressure, check your blood sugar, your cholesterol, and things like that. So you can read through the newspaper, the various, one that we have here and so forth, and see what's going on in the community. The other thing people could do also is they can call the Board of Health for their town, for example, and find out is anybody screening for diabetes anywhere, or their local hospital. And many of the times they'll say, on March 1st they're having this big fair, and you can come in and get checked and whatnot, and they can find out. Or call a family member and say, I want to get checked. Who's your doctor? Who can you recommend? Maybe I should go see someone.
What behavioral changes should I look for when determining if I have diabetes?
He was sleeping.
I used to now and then, not only when I was watching TV, which a lot of people, it happens when they watch
And
TV,
then not off.
but even when I'm not watching TV, all of a sudden I kind of drift
He was
off.
sitting at the counter reading the newspaper, and I
Yeah,
look over there,
and
and
that was one of the symptoms.
he'd be like,
I was sort of dozing off, and I don't know, tiredness or something. But I think that was a main thing, a big main thing.
Okay, one of the things that we brought up during rehearsal yesterday was in older men, one of the problems, typically men having large prostates, they may get up at night to urinate more frequently. And sometimes
that was interesting when you brought that up.
they'll start urinating more frequently, just saying, it's the darn prostate again or whatnot. But it really isn't. Something significant has changed, and one of the reasons for that is that blood sugar maybe is going up, and now they've become diabetic. And when you urinate all night long, you don't get restful night's sleep, and then you become more and more sluggish. So it's a very vicious cycle, but it may get overlooked for quite some time because of the fact that they think it's one problem where it really is something else. And that's why if you see a subtle change like that, really you need to go see the doctor and get checked out. It might be infection, it may be diabetes or something else, not just the factor of your prostate for them to identify. And even women also, with incontinence, if they notice that their incontinence is dramatically changed, I'm going all the time. Well, it may not be that your incontinence is getting worse. It may be because the fact that your blood sugar is elevated, the fact that you become a diabetic or even pre-diabetic.
How often should I check my blood sugar?
The testing itself, if you are diabetic, usually we'll try to get our patients to check them twice a day, ideally fasting in the morning when they get up, so we know what their fasting blood sugar is. And we usually want to get 1 2-hour postprandial, we call it. So after dinner, check about 2 hours after so we know what kind of range you're in. When the person becomes very well controlled, then we'll cut back a little bit and say, all right, just do a fasting, say 3 times a week or 4 times a week, depending how brittle they are. The other test that we use for diabetes to monitor you is that hemoglobin A1C test.
What?
That's the blood
I've
test.
heard of that.
Okay. There's another blood test that we use to monitor patients with diabetes called the hemoglobin A1C. Basically, it's kind of a broad range of what your blood sugar has been doing for 3 months. So ideally in diabetic patients, we try to keep that number below 7%. And the reason being is that that's how we know you've been in relatively good control for the better part of 3 months. Now, the issue when I say that 2-hour postprandial, some patients, they wake up in the morning, their fasting's perfectly normal. However, when they go and they have breakfast, lunch, dinner, their sugars are shooting up 200, 225, 230 because they may have too many carbs in their diet at that point, they're eating too much. So that hemoglobin A1C can be elevated because both your fasting and your postprandial are up, or just because your postprandial is elevated, what you're eating. So that's why those two numbers are important when you're checking your blood sugar.
Mm-hmm.
And that the man who's checking it 4 times a day, God bless him. He wants to be precise with the control of his diabetes. In your patients who want to be very proactive like he is, and the family members, what I do is I write everything down for them on a chart. If your blood sugar is this, you're going to do this. If it's this, you're going to do this.
Well, that makes it easy.
Exactly, and then you just follow that chart and you eliminate the phone calls. Doctors want to hear that something's wrong, but if something's right and the person's not sure, well, let's write it down so you know for the future. The other thing is when you don't feel well is the other reason you check your blood sugar. If he's getting more sleepy, if you find you're urinating more frequently again, check your blood sugar in the middle of the night if you have to, because it may be elevated. And it may have been because you had too much birthday cake the day before or something like that.
Too much what?
Birthday cake when your
Well,
birthday
you're
comes
very
in.
good about all.
Yeah.
You're very good about your food.
Other people aren't. Or they don't really know how much carb load they're partaking in at night. They went out to the Italian restaurant and had pizza, spaghetti, this, that, and they've been doing it all week. There you go. You're away a lot from home, eating out all the time. There you go. It's not your typical diet. I know you're very vigilant, believe me, I saw the way both of you ate yesterday. But sometimes we slip, and if you keep slipping every day, your sugar's going to go up. So the only way to know is to check your sugar. And diabetes, and actually Medicare picks up for most of your diabetic supplies, just how many tests you do per day.
Oh, that's good to know. We should be telling people that.
Mm-hmm.
That's also an encouraging thing to tell them. Medicare will pick up on a lot of your supplies.
Correct.
Where can I go to get more information?
But one of the things to keep in mind is that a lot of these questions, patients can go to the Novo Nordisk website. It has the AskReno.com, and they can also just go to the main website and pick up all this information that's there for them.
That website's really important
Exactly.
for people to go to.
What's the most important thing I can do to help prevent diabetes?
The main thing is go out and get checked. It is, a silent disease. As when they were all growing up, the senior citizen population that we have today, they thought, high blood pressure and heart disease was the main thing that was a silent disease. So is diabetes. Mm-hmm. And the quicker you pick up...
Osteoporosis is another one.
Right, exactly. And the quicker you make the diagnosis of these problems of prediabetes, the more aggressively you can attack the problem and prevent people from going on to diabetes, prevent people from getting all of the horrible complications of blindness, kidney disease, stroke, peripheral vascular disease causing amputations, and so forth. And that's what's key here and what's so important that we have to express as the message.